As soon-to-be nomad retirees, medical care abroad was our biggest concern. Then emergencies hit within our first 6 months. We faced a dental crisis, ER situations, and a hospital admittance. Today we have many answers and we are sharing them in this video. First, a tooth crisis. I was in Albufeira at the time in southern Portugal when I discovered that I needed wisdom teeth removed. One was starting to hurt a lot, and I soon found out that I had to quickly move on this. How I found a place: I did a Google Maps search for dentists near me and chose one based on high ratings, many reviews, and its location directly adjacent to where we were staying. The dental clinic did x-rays, and they showed a huge hole in the painful wisdom tooth under the gum line. It could have abscessed any day, so the dentist had to promptly put me on antibiotics and book an extraction for the following week. But I also got a happy surprise. The extractions would be done with local anesthesia only. No general, which meant no pre-op fasting, no post-op vomiting, and it was the easiest dental procedure ever. The dentist was excellent, fluent in English, and very kind. He sensed my fear, so he talked to me for half an hour, just light, bubbly chit-chat, and once he saw that I was relaxed listening to his stories, that's when he did the extractions, which took all of 90 seconds. Imagine getting all that extra time just so you wouldn't feel afraid. I couldn't believe it. As for the cost, it was 1/9 of what I was being quoted in the United States. It cost me $220, while 2 different dentists in Las Vegas were quoting me $2,000 for the same pair of wisdom teeth to be extracted. And with general anesthesia, no thank you. Also, this dentist in Albufeira did a follow-up 1 week later at no additional cost. This exceeded all my hopes and wishes. And this was just from doing a very basic search on Google Maps. This experience was a home run, a 10 out of 10, and honestly, I would give it a 20 out of 10 if I could. The next story was a heart scare. This one took place in Padua, Italy. It had been getting increasingly hard for me to walk uphill, carry heavy things even for only a few seconds, and do other things that required exertion. And not in the I'm out of shape kind of way. It was worse than that. So again, using Google Maps, I searched hospitals near me and picked a centuries-old, prestigious teaching hospital with great reviews. I got to the ER and they took me in immediately. In fact, there were really no patients in the waiting room. It was pretty much just the patient's family and friends. The patients were getting always admitted right away. There was no waiting, no delays, no confusion. And once the ER did all of my tests that were required, they gave me a referral for a cardiologist. They said everything looked fine, but that was all that they were able to do at the ER. Next, I needed a specialist. I picked one that was in that same hospital complex. I called and they were able to schedule me for the following day. So I walked in at my scheduled time, 3:30, and they called me right in at 3:31. There was no waiting at all. And on top of that, they took me into a room and there was the doctor. It wasn't meet with an aide, they run a few basic tests, and then I have to wait another 45 minutes. I saw the doctor right away. We discussed, he reviewed my paperwork, and then he decided I needed 2 additional tests, which he performed himself, not an assistant, not a tech, him. He was very gracious the entire time, very kind, and he was fluent in English. And he called it right off the bat. This condition had been a mild concern for years till it became a much bigger concern over the past few months. He prescribed a medication and it fixed the problem overnight. Every doctor I spoke with subsequently agreed with how he called it and what he prescribed. They all said it was a great solution. So, like the wisdom tooth story, this was a lovely experience, a caring doctor, great facilities, and a treatment that hit a home run. As for the cost breakdown, the ER visit base price, $25. Blood tests ranged from low-end $1 to high-end $12 each. Other ER tests were $28. And here comes the expensive part of the ER, which was the ER doctor's consultation fee, $45. The cardiologist's appointment's base price was $152, and it did not go up even after he added on 2 additional tests. The medication for 12 weeks was $9, so that was 3 weeks for each 4-week packet. The total for all the medical doctors and the facilities for this incident was $284, plus the $9 for 12 weeks of meds. Another 10 out of 10 that really deserved to be a 20 out of 10. Story number 3 is the big dog accident. So, all did not end well that day after we ecstatically left the cardiologist and returned home, because within an hour after we got home, Greg and I had to take out 2 large dogs for an evening walk. Greg was holding both leashes when a small dog lunged at them. Instant mayhem followed, dogs running at each other, barking and growling, and suddenly our big dogs bolted so hard that Greg was yanked off his feet, slammed onto the pavement, back first, and then hit his head. So we had to grab a cab straight back to the ER. They took him in, ran tests, and determined quickly that he had to be admitted to the hospital. He was there for 4 days. They began by draining the edema. They put him in a neck brace that he had to wear for the following 3 weeks. And the situation required multiple doctors, nurses, aides, specialists, and medications. And for 4 days, the entire hospital and ER bill came out to $1,640. $400 a day for round-the-clock hospital care in addition to the ER. In the US, would $1,600 even cover 1 hour of ER outpatient? I don't know about that. So they fixed him up. He healed 100%. Everybody was wonderful. And the price was, again, unbelievable. Greg is actually right here working on something else. So I'm going to ask him, Greg, how would you rate your hospital experience on a scale from 1 to 10?
10.
Well, as you see, he didn't even have to think about that. And he didn't know I was going to do that. So those are our first 3 stories. But now there's actually a 4th medical event that is still a little bit unfolding, and it is completely different from any of these 3. It's far more complicated, involved 3 ERs, more than 1 country, and the days of 10 out of 10 were over. There's a lot to that story, so it really needs its own video. And as I said, it's still a little bit evolving. We're not exactly sure how this one's going to resolve yet, but we're almost there. And that story shows a whole different side to medical tourism and gives a lot to think about. So that's everything for this installment. Thank you for watching, and see you then.